Jane Hooker is the Prevention of Violence Against Women Program Leader at the Women's. She's responsible alongside Bendigo Health for the leadership of the Strengthening Hospital Response to Family Violence Program and more recently the statewide leadership for Family Violence Workplace Support Program within Victoria. Jane has worked as a manager and nurse specialist in sexual, reproductive and women's health for the last 20 years in Australia, New Zealand and the UK. Give her an extra special welcome, Jane Hooker.
Right. Well, welcome everybody. Amazing. Big SHRFV welcome to you all. And I can't believe, I'm just looking at you all, I can't believe how many of us are here this year. Many of you here at last year's forum? Stick your hands up if you're at the last year's one. Gosh, look at the difference. So look, it's about 3 times as many here that haven't been to the last forum. So look, big welcome from the Women's and also on behalf of the Bendigo Health as well. You already know who I am, hopefully. So my name's Jane Hooker and I look after not only the SHRFV team at the Women's Hospital, but along with Bendigo Health, and where's Bendigo? Just there. We look after the sort of statewide leadership role, really, of the rollout of SHRFV. And I am just really privileged and happy to be here today. It's great to see you all. Look, I think the Women's, again, I'll reiterate again, I think Women's have done a pretty good job and this venue's pretty amazing. And Peter Mac was great last year as well, but we needed to find a venue that was a little bit bigger for us, of course. And that's not very easy in Victoria as well. And look, and if you're keen on having some 80s music flashbacks as well while you're here, feel free to pop downstairs to the most amazing exhibition down there that will make you all feel quite old and ancient. But look, don't leave yet, because I'm just going to start to talk about the toolkit, and I can't believe that we're about to hit the button. In fact, we hit the button yesterday and we've launched the 4th edition of the toolkit. And for those of you who've been involved, it's been an incredible amount of work. We've done a complete revision of the toolkit and we've got about 20 new resources as well, which that in itself is pretty amazing, isn't it? We're really, really proud of this work and we're really proud of the look, quality and content of this edition, and we hope you think that she's just as every bit as helpful as we do as well. So, feedback from last year's forum, and we always like to listen to you, and also our community of practice, indicated that you wanted more information about the toolkit at the forum, so that's why I'm standing in front of you today. And although the session is probably a little bit more relevant to those of you who are working directly in SHRFV, hopefully the rest of you here today will be tempted to go online and have a little look at the toolkit as well, because it's pretty great. And how useful is the toolkit? Well, just to give you some idea, every month we have 1,000 visits to the online toolkit, which is pretty impressive, isn't it? And we have 250 downloads of documents. So that really indicates to us that you're using it and that you're using it really well. And we love that, we love it. And look, in each year we build and adapt the content of the toolkit according to your needs and also according to the changing landscape of family violence. And gosh, hasn't it been a huge time of reform in family violence? We've got the Orange Door Support and Safety Hubs that are opening across the state. And of course, they're going to have a big impact on our referral pathways. And the new Marram and information sharing changes will undoubtedly change the expectations on health professionals. Look, many of the larger reforms are yet to come. Some have been a little bit delayed. So we've tried to make the toolkit as adaptable and flexible to those changes as they roll out this year. And I know that we're going to have a session later on today about some of those changes that are coming. So, now on to the toolkit changes. So look, besides the new content, revised data and other reform revisions, we've actually changed the look and feel of the documents in the toolkit as well. And look, after 3 previous editions, it was starting to feel like it had been written by many hands, and that was because it actually had been written by many hands. So we've had a full professional editor's review of the core documents, and that's given it a bit more of a standard voice. So look, that hopefully means that you'll feel very happy to be able to lift those tools, particularly the core ones, and be able to use them a bit more easily without having to rewrite them. And all documents now have a SHRFV shared look and feel. You can kind of see our little cute birds on everything, and they look pretty. They look pretty professional, actually. They're great. So this toolkit, and Sue's mentioned it before, has a revised focus on element 2 and 3 of the SHRFV approach, and much of the new content is particularly focused on better supporting our people and staff with the challenges of family violence, including personal experience. As Sue's talking, Kelsey's video really highlighted and clearly state, looking after our people is the crucial step in implementing family violence reform within health. And it's going to make, by kind of looking after our staff, of course, it's going to make sure that there's a real meaningful cultural change in health services. The Toolkit core documents clearly now reflect workplace support in maintaining a staged rollout of SHRFV. At key and numerous points, the Toolkit states that staff-facing support must come before rolling out any patient-facing training or work, and that wasn't so clear in the second and third editions. We've also reviewed all training modules with an adult education eye and have included specific activities to offer focus and be less didactic. So because, as Nellie mentioned beforehand, sometimes the content can be very, very hard going for some staff. We've got some more activities we've included in there as well. So in total, there are 15 new tools to the workplace support program, and we hope that that's going to further enhance and support you in all the wonderful work that you're doing. So we've also got new tools that will hopefully help you sustain momentum and support. New to this year are session plans for Module 1 and 2. And we hope that if this training is new for you, or if you want a refresher, the session plans are going to help give you some confidence and a few more pointers as well. We've got basically a whole heap of new tools as well to support the rollout of clinical champions. And I probably don't need to sell it to most of you, but clinical champions are so important. And they're so important to the capacity building and sustainability of SHRFV. We've got a whole session dedicated to it later on today. But we've also got some more tools anyway just to help you roll out that side of the work. We've added reflective practice case review templates as well, and they are meant to encourage all workers interacting with victim survivors of family violence to critically review their practice really, and to encourage practitioners to consider the following: what did you do, why did you do it, how did you do it, and what might you have done differently. We've also included 2 new events for basically events and communication guides and practices, because basically, as we all probably know, and as you've started to roll out, and lots of you have done some amazing events this year, and Sue put some pictures up beforehand, they can be quite difficult to roll out, and not all services, particularly some of the smaller health services, have even communication teams. So we've included a special events plan, which is a step-by-step guide to hosting internal or external events, such as your 16 days and your SHRFV launches. And we've also added a new communication action plan. So that's your how-to guide to raise the profile of SHRFV in your services as well. Many of you probably noted that last year with the 3rd edition, we released specialist modules, and they were added to really further enhance your suite of training tools and materials. And look, this year in the report was amazing because 35% of you reported that you had already started to deliver the specialist modules, which is incredible considering only 50% of you are new to SHRFV. So we were really, really pleased. So this year, we're releasing Train the Trainer videos, so you can learn from the experts and can see and experience how they deliver this content. This new digital content for specialist modules covers all 4 of the rural regional setting modules: paediatric, older people and sexual assault. And we have our fabulous SHRFV experts, most of you I think are here today, I can see you all in the audience, who basically delivered these for you. There's little videos that run in the corner up there. So look, special thanks to St Vincent's, the Royal Children's, Bendigo and CASA Forum as well. And again, we hope to support you all as you continue to roll out your training. Sue's already spoken as well about the need to learn and listen to the voices of survivors of family violence, and survivor advocates may be our patients, and they also may be our staff. And although we try and make this inherent in all our toolkit work, this year we've included 2 new specific resources. One is a guide to working with family violence survivor advocates, and the other is a video resource of an interview with Sharon Ermel from Bendigo Health. Sharon's just down there. And Emma Gershling. Is Emma here today? I've not seen her yet. No? Emma's a tireless survivor advocate, actually, particularly when it comes to working with children and disabilities in the context of family violence. And actually, she also sits on our PAG, and she actually helps with both documents as well. So as one of our survivor advocates, Tracy, has said, hearing the experience of others creates a bond in a community of people who have come out the other side of violence against women. In doing so, we're standing up against the isolation and the silence which once ruled our lives. And as organisations, we must ensure that our engagement and partnership with survivor advocates is authentic and respectful, and that the safety and wellbeing of advocates is the most important consideration. Just as a footnote though, don't forget that many of the staff who put up their hands to support SHRFV and work on your governance groups and in your teams have personal experience of family violence. Later on today, we'll see the launch of the digital storytelling project Beneath the Surface, which gives a voice to our health professionals' experience of violence as well. So, e-learning. Face-to-face training when it comes to family violence is so vitally important. I can't say that enough. And when you consider the content, face-to-face training is recommended as being more supportive than e-learning. We know that the latest research shows that family violence affects 45% of our clinical staff personally and many, many more indirectly. And our training can often be the first time that training for family violence has ever been provided to staff. And those of you in the room who train, and there's a lot of us, also know that with every small or large session we run, we have staff disclosures, either in the group or following the session, and we normally see a spike in our family violence intranet pages and with our contact officers post-training. We will frequently also have that someone, or sometimes more than one person in a session, that needs a little bit more convincing and has questions about the drivers or consequences of family violence. It's really, really important that we answer these questions openly and respectfully and in a timely way. In e-learning, you can't always do that, can you? However, we're also really aware that in a busy health setting, face-to-face training is not always possible, and on occasion the length of training time available, particularly to our clinical staff, is just not enough. So that's why we've developed e-learning Module 1. It's to support clinical staff in accessing training. It is to be delivered no more than 4 weeks before face-to-face training of Module 2, and that's for all those above reasons. Look, we like what we've done with e-learning, and it's been through a pilot phase, but it's new and we can't wait to hear what you think of it. Thanks also to the working groups across many of the hospitals that are here today that helped us to develop and test this content as well. And look, if we have anyone in the audience that is hoping this will completely replace face-to-face training, and I'm looking at you executives in the room, I'm sorry, but not on my watch. Let me state really clearly that we'll be doing our staff a huge disservice if this happens. We won't create the cultural change required, and we could actually end up doing more harm than good. We must put the health of our staff first. Thank you so much for all your expertise, feedback and support with the 4th edition. That's me on the phone. Quite knowing what I'm doing. With so many new services on board in 2007, we really needed feedback about how it was or wasn't able to be adapted or shaped to fit your health service. And again, with over half of you new to SHRFV, this feedback has been just invaluable to ourselves and to Bendigo as well. Many of you here today took time to review content and help us build the tools. The Toolkit is a result of collaboration. So even if you weren't directly involved, we've always had your health services at the heart of this new revision. The Toolkit was never designed to be a manual or a one-size-fits-all solution, but is there to be adapted and pliable and to give you some structure and support. If it's not flexible, it's not doing its job. However, here's another little rant from me, with flexibility and adaptability comes responsibility. Therefore, here is another message for those of you directly involved in SHRFV that are here today. Please, please, please do not ever dilute or minimise the key family violence messages around gender equity in your training or in your content. If you can, ensure that your role in the funding you've received this year is being well used. Your messaging is key to ensuring a sustainable and quality SHRFV. The Toolkit though, although incredibly important and we've spent a lot of time on it, is just one small element of SHRFV. Keep committed and focused by keeping in contact with us in Bendigo and keep in contact with other services. Be involved in SHRFV meetings and the online community of practice forums. Continue to be transparent and be generous and listen to others who have been there before you. Remember, we're all each other's best hype people. Health organisations are all unique, and I don't dispute it, but actually we're all quite similar as well. The Minister is following me, and I hope I'm not stealing her thunder a little bit, but SHRFV has to happen in a timely way over the next 3 years, and we don't have time or unlimited financial resources to all reinvent the wheel at each of our services. And why would you want to when you can just change a tyre or adjust the suspension? It's my little toolkit analogy. The Toolkit has been developed with and by family violence experts. It's there to make your lives easier, to ensure some commonality and quality in the work we're all doing. We all know sustainability is going to be a huge challenge over the next few years, and we hope the Toolkit will help you, but ultimately you will succeed by doing what you do well, doing it together with others, and doing it loudly and proudly. And I really look forward to catching up with many of you over the course of today. Thanks so much.